go. So I have checked the patient's chart. There is no precaution signs on her door, so I'm good to enter. Hello,
Hi, come in.
my name is Daisy. I'll be your nurse today. What's your name and date of birth?
Maria, April 111.
Okay, can I see your wristband?
Sure.
Great. So I'm just gonna ask you some questions, okay? Might be a
Yes.
lot. So do you have any chest pain?
No,
Any numbness or tingling?
no,
Are you short of breath at all?
no,
Okay. Do you have any family history of heart or lung disease?
no,
No. Any fainting spells?
no.
All right. How about your bowel movements? Are you going to the bathroom just fine?
Yes.
Are you voiding just fine?
Yes.
Okay. And then any history of or any feelings of anxiety or depression?
No.
You're fine. Okay. So I'm going to be doing a head to toe assessment today. Are you okay with that?
Yes.
Okay. So I'm just going to be doing a run through head to toe, okay?
Yes.
So we're going to start with your cranial nerves. Do you mind closing your eyes for me?
Sure.
Tell me what you saw.
Grapes.
Yes, grapes is good. All right, so I'm moving on to cranial nerve 2, 3, 4, and 6, which is the optic, ocular motor, trochlear, and abducens, and those innervate the muscles of the eye, okay?
Okay.
I'm going to have you follow my pen, just your eyes, not your head, okay?
Okay.
Okay, great. So I'm going to be checking your pupils, if you don't mind just looking right over my shoulder. All right, so pupils are equal, round, reactive to light, and accommodation. Moving on to cranial nerve 5 and 7, which is the trigeminal and the facial. If you don't mind smiling for me, frowning for me, puffing your cheeks, raising your eyebrows. Okay, and I'm gonna have you close your eyes and let me know where you feel sensation, okay?
Yes. Forehead. Chin. Left cheek. Right cheek.
Perfect. Moving on to cranial nerve 8, which is the vestibular cochlear, and that's for sound. If you don't mind closing your eyes and letting me know what side you hear noise on.
Left. Right. Left.
Perfect. Moving on to cranial nerve 9, 10, and 12, which is the glossopharyngeal, vagus, and hypoglossal. And those are responsible for the nerves of the mouth. You can go ahead and open your eyes for me. Can you say ah?
Ah.
Okay. Can you stick your tongue out and move it side to side for me? Okay. She has been answering all my questions, so I know her tongue is moving just fine in there. We're moving on to cranial nerve 11, which is the accessory. If you don't, I'm going to put my hands on your shoulders if you don't mind pushing up against my resistance. Perfect, thank you. Okay, so let me just do it. So while you're here, I'm going to check your carotid pulse. Okay, you turn your side. Thank you. That feels nice and strong. And while I'm here, I can see that her trachea is midline. Can you turn your head to the side for me? No sign of JVD. Okay, and then I'm going to take your radial. Okay, strong. And brachial. Let me do it on both sides for us. Okay. All right, nice and strong. So I'm going to check your heart and your lung sounds now, okay? I'm going to have you pull your gown down just a bit. Okay. I'm going to start with your heart. All right. So we're going to go with intercostal space 2, which is aortic. Intercostal space 2, pulmonic. Left sternal border. Intercostal space 3, Erb's point, left sternal border. Intercostal space 4, tricuspid, left sternal border. You mind raising your breast for me just a bit. Intercostal space 5, mitral, which is also the PMI, point of maximal intensity. Okay, I'm going to turn my bell around the other way and take a listen all the way up for any abnormal sounds, okay?
Yes.
Mitral, okay, tricuspid, Erb's point, pulmonic, aortic. Okay, also while I'm here, I'm going to check for capillary refill in your hands, under 2 seconds. And then can you squeeze my hands? Wonderful. And then can you close your eyes and stick your hands out for me? No pronate or drift. Okay. And then can you push down on my hands? Can you flip your hands? Push up on my hands. That's great. Okay, so I'm going to go to your bowel sounds here on your abdomen. And I'm going to start with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, that sounds good. No hyper or hypo activity in there. So I'm going to go ahead and palpate, okay? Let me know if you have any pain. Any pain at all?
No.
Okay, I'm going to check for rebound tenderness.
No pain.
You're good. Okay, I'm gonna move further down here. I see the patient doesn't have a catheter, and she did tell me you're going to the bathroom just fine,
Yes.
and then your bowels, urinary, everything's
No
fine.
problem.
No problem. Okay, so I'm gonna continue down. Before I do that, can you put your hands down for me? I'm sure. Just lay down on your side. I'm gonna just check your upper extremities for symmetry. You are warm to the touch. Okay. Do the same thing for your lower extremities. She's warm to the touch. Color is good. Hair distribution is good. Okay. I'm gonna check for your pedal pulse. Posterior tibial pulse. Posterior tibial. Okay, I'm gonna check for the Babinski reflex. And that's good. Can you push down on my hands? And can you push up on my hands? Perfect. And I'm going to check your capillary refill here. And that's under 2 seconds, so that's good. That's good. Okay. I'm going to bring your bed down now. Once I bring your bed down, if you can please swing your legs around the bed. I'm going to be checking posterior lung sounds, okay?
Okay.
All right. Go ahead and sit up for me. Swing your feet around. Actually, can you lay back down for me? I haven't checked your front lung sounds.
Sure.
Thank you. Let's start with intercostal space 1. Intercostal space 1. Intercostal space 2. Intercostal space 3. Intercostal space 4. Intercostal space 5. Intercostal space 5. Okay, now if I could have you swing around your feet to the front, so I'm gonna check your backside. Okay, if you don't mind giving yourself a big hug for me, and I'm bending over slightly. Take a deep breath for me, please. Just checking for fremitus or crepitus. One more deep breath. Okay, so I'm identifying her C7 there, and I'm gonna osculate. Take a deep breath for me whenever you feel the stethoscope.
Well, actually, it's not uncontrolled.
T1 to T10.
Yeah, that is.
This is just used with under control. I don't know if that means so.
Put down one more as we're about her lungs end. Okay, that sounds good. And now have you stand for me, feet together, eyes closed. She has good balance. Romberg's test is passed. And then if you don't mind taking 5 steps towards me, heel to toe. Wonderful. If you can turn around for me and walk normal. I'm looking at her backside. She has no skin breakage on any of her bony prominences, so that's good. And then, can I have you lay down for me?
Sure.
Okay. And then, are you in a comfortable position?
Yes, thank
Do you have all your possessions?
Yes.
Okay. Do you have any pain?
No.
Or do you need to go potty?
No.
Okay. Well, here is your call light. You're welcome. Hand hygiene. And then unscreen patient. And then document.